the federal government's free C-section scheme launched in November 2024 under the Maternal Mortality Reduction Innovation Initiative was designed to remove costs as a barrier to emergency childbirth care. The program promises free or subsidized cesarean sections for poor and vulnerable women at selected public and private health facilities, but implementation appears to be a stumbling block for a program designed to bring relief. Tahnteh Azal reports.
More than a year on, the life-saving policy is showing results, but it's also facing real challenges that limit its reach, especially in rural communities. According to the Health Minister, by April 2025, over 4,000 women had accessed free C-section services through the scheme. That number, officials say, represents lives potentially saved.
In relation to CS and CS problem, CS in relation to maternal and health and death and rest of them, what actually happens is that it's obvious that the roadmap for NHIS in Nigeria is not well specified to carry along those in the villages. If you watch very closely, it's majorly people that enroll there is civil servants and people working in some private sectors. And this thing is meant for the poor people. That's the essence of its innovation in the rural villages, so to reduce that maternal and infant deaths, but it's not going through. What actually should have done is that if you watch in the scenario of medical sciences in Nigeria, they're supposed to have people in doctors, nurses that will take care of these people in the villages on ground, so that they will be carried along.
But on the ground, many women, including those who need these services most, say they never knew the program existed.
I never hear it because the hospital that I'm attending before, I never hear anything about that this government is helping people. All less that people that is following to follow to help the needy, not be to give money from government to help women in bed.
I've not heard it before. I'm hearing it from you for the first time. Imagine me in town. I'm not even aware of it. Talk less of people in the village. We don't have any healthcare system in my village. So you can imagine that people in my village are not even aware of it. I'm from Agaliga local government. That is Olamaboro local government.
For women in remote areas, the disconnect between policy and awareness can cost lives. Dr. Chukwudi says the lack of information is one of the biggest hurdles.
People canvassing, informing the masses the major things they have, because nobody knows the package of NHIS in the villages. Thereby, they are not even enrolling. Even if they enroll, do they have that doctors on ground? It's not there. The nurses will not be there. The primary health care don't have such capacity. And that's, in advanced countries, it's supposed to be there. We're supposed to have a doctor that will be there to take care of a cesarean section and those that will even take care of all those women from family medicine before even going to cesarean.
Experts argue that awareness is only half the battle. They say getting more women registered with the National Health Insurance Authority is crucial. Registration, they explain, is often the key that unlocks access to the free C-section benefit. Without it, many women still bear the cost of emergency care or avoid hospitals altogether. Healthcare workers and advocates say that with better public information, stronger community engagement, and wider NHIA registration, more women could access timely care. Tahnteh Azal, Trust TV, Abuja.